Welcome to another episode of Angel's Awesome Minds podcast powered by Angel's Awesome Books.
If you're here, you're probably already navigating the world of neurodiversity, maybe with a young child diagnosed with Autism Spectrum Disorder.
But then things get complicated.
Exactly. What happens when ADHD, attention deficit hyperactivity disorder, is in the picture too?
It's an incredibly common scenario, and frankly, it can create a lot of confusion for parents and even for clinicians.
So today, we're going to try and cut through some of that confusion. We're digging into research that compares kids with pure ASD, pure ADHD, and that complex group that has both.
Right. And our mission here is to figure out what's really driving the long-term challenges. Because, understanding that is the key to intervention.
And it's so critical because having both disorders, it's more than the sum of its parts. We're going to be talking a lot about a metric you need to know: adaptive functioning.
Let's start with just how often this actually happens.
Okay, first question then. How frequently do we actually see ASD and ADHD together? And, what does that really mean for getting a diagnosis?
The rates are they're extremely high. That's really why we're having this deep dive.
Okay.
If you start with a group of kids who are already diagnosed with ADHD, about 13% of them will also meet the criteria for ASD.
So not a tiny number.
Not at all. But here's where it gets really interesting. If you flip it, if you look at children diagnosed with ASD first, the numbers are staggering.
Yeah.
We're talking anywhere from 40 to, in some studies, 70% of them also have clinically significant ADHD symptoms.
40 to 70%. That's huge.
It is. And it's a big shift in how we think about this because not too long ago, you couldn't even get that dual diagnosis.
Right. The old rule book, the DSMIV, it said they were mutually exclusive.
Exactly. The thinking was if a child has what we used to call a pervasive developmental disorder, then any hyperactivity or inattention was just seen as, part of the autism.
Which we now know just isn't right. It was ignoring a massive piece of the puzzle for so many kids.
A huge piece. Now, thankfully, the DSM-5 and the newer 5-TR, they recognize these are two separate conditions that can and do coexist.
Yeah.
And diagnosing both is absolutely essential.
For effective treatment, you have to see the whole picture.
You have to. And there's another interesting layer here, which is the timing of it all.
How so?
ASD is usually diagnosed pretty early, often before a child is even 3. But the ADHD, the inattention and hyperactivity, that often doesn't get a formal diagnosis until the child is a bit older.
Maybe when they start school.
That's the classic trigger. The structure of a classroom, the academic demands, they really put a spotlight on those attention deficits. So for a lot of parents, the ADHD diagnosis gets layered on top of the ASD one later on.
That makes perfect sense. Okay, so for a parent trying to understand this, let's break down the pure profiles. What are the biggest clinical distinctions between a child with only ASD and a child with only ADHD?
It really comes down to the why behind the behavior. The core of pure ASD is a fundamental difficulty with social communication and, of course, those restricted or repetitive behaviors.
So they might struggle to start a conversation or keep one going back and forth?
Exactly. The social difficulty really stems from a deficit in, let's say, the social motivation itself, or in understanding the cues. Their inattention is often internally driven.
Focused on a special interest or maybe a sensory thing.
Precisely. Now, you contrast that with a child with pure ADHD. Their challenges are all about inattention, distractibility, impulsivity.
They can't sit still, they forget things, they talk constantly.
Right. But here's the key. Their social problems are often a matter of execution. They usually want to be social. They want friends.
But their impulsivity just gets in the way. They interrupt. They can't wait their turn in a game.
And that ends up looking like a social problem, too. And it is, but it's for a different reason. The research calls it a negative reputation. Peers get frustrated with them.
So both kids might end up isolated, but the root cause is completely different.
That's the critical distinction. And this is where that term we mentioned earlier becomes so important: adaptive functioning.
Okay, let's define that really clearly. This isn't about IQ, right? It's not about how smart your child is.
Not at all. It's about how well they manage life. It's all the practical, everyday skills you need to be independent.
Like getting yourself dressed or asking a teacher for help.
Yes. Communication, socialization, daily living skills. We measure it with tools like the Vineland Adaptive Behavior Scales or the VABS.
And what does that tell us when we compare it to a child's IQ?
It tells us so much. In children with ASD, we consistently see their adaptive skills are way, way lower than their cognitive ability.
So they can be incredibly bright intellectually.
Very bright. But their ability to use that intelligence in practical, everyday life, especially social situations, it lags way behind. That gap is a huge hallmark of ASD.
The smarts are there, but translating them into life skills is the core struggle.
That's a perfect way to put it. With ADHD-only kids, that gap between IQ and adaptive skills is usually smaller. Their struggles are more tied to, say, executive functions,
Organization, planning.
all of that. Which brings us to the really tough part. What happens when these two profiles collide in one child?
Right, the comorbid group. If they're both challenging on their own, what does the research say about the combined effect?
It's not additive, it's exponential. The impairment is significantly greater across, well, every domain you can measure.
So school functioning, emotional health, daily life, everything is harder.
Everything. Let's just look at ADHD severity, for example. The chance of a child having a severe ADHD presentation basically doubles if they also have ASD.
Wait, say that again. The autism makes the ADHD symptoms worse.
It appears to exacerbate them, yes. In the comorbid group, about 35% are classified as having severe ADHD. In the ADHD-only group, it's more like 17 or 18%.
Wow. So they just get hit harder from both sides.
They do.
Yeah.
And remember that gap we talked about between cognitive ability and practical life skills?
Yeah.
It's even bigger in the ASD plus ADHD group than in any other. Their practical skills fall even further behind their intellectual potential.
That sounds just overwhelming for the child, for the parents. It's like, which fire do you put out first, the attention issue or the communication one?
And that is the million-dollar question. This is where the research gives us a really transformative insight.
Yeah.
We can actually look at what's driving that poor adaptive outcome. Is it the severity of the ADHD symptoms or the severity of the ASD symptoms?
Which one is doing the heavy lifting in terms of impairment?
Exactly. And the answer is really striking. The severity of the ASD symptoms, the core autism, accounted for the overwhelming majority of the problems in socialization skills.
So it's the autism.
It's the autism that's the primary driver of those social skill deficits. And it also significantly predicted the gaps in communication and daily living skills.
Okay, so let me get this straight. Even though the hyperactivity might be really severe and obvious, it's the underlying autism that's causing the biggest long-term struggles with independence.
That is the single most important takeaway from the data. While you absolutely have to manage the ADHD symptoms, the fundamental social and communication deficits from the ASD are the strongest predictor of those deep adaptive skill gaps.
Understanding that, that has to change how you approach everything.
It has to. It tells you where to prioritize treatment.
Which leads us right to the next big question. With all this in mind, what should parents prioritize when they're thinking about treatment and intervention?
Well, the number one principle has to be there's no time to wait. Intervention needs to be early, it needs to be immediate, and it needs to be comprehensive.
And for the little ones, the preschoolers.
For preschoolers, the consensus is really strong. You should prioritize behavior therapy before introducing meditation.
You have to build that foundation first. Parent training, early intervention.
That work has to come first. But of course, for many of these kids, the attention and hyperactivity are so intense that medication becomes necessary just to allow them to access that learning.
And what should parents know about medication for this comorbid group? Is it different?
It can be. Parents should be prepared for the fact that response rates to standard stimulants like methylphenidate might be lower.
Lower than for a typical ADHD case.
Yes. In typical ADHD research, you see response rates around 70, maybe 80%. In the ASD population, some studies report it's closer to 49%.
That's a huge difference. That means the trial and error period could be much more frustrating.
It can be. And side effects can also be a bigger concern, especially if a child has language delays or intellectual disabilities.
So the risk-benefit calculation is it's tighter.
It is. But there are good options. For instance, non-stimulants like atomoxetine have shown they're often better tolerated in this group. And what's really insightful is that for these ASD plus ADHD kids, atomoxetine was found to be more effective for the hyperactivity than it was for the inattention.
That's incredibly specific. So if the main thing stopping your child from learning in therapy is that they literally cannot sit still.
A non-stimulant might target that specific behavior really effectively, and that opens the door for the behavioral therapies to work on those core adaptive skills.
So it's all about the integrated approach. You can't just medicate the hyperactivity and hope the social skills catch up.
Never. That is the crucial point. Success comes from combining smart medication management with targeted psychosocial interventions, behavioral therapies, family training. You have to attack the problem from all sides, always remembering that closing those communication and daily living skill gaps is the ultimate goal.
That's a really clear and powerful message.
So if you only take one thing away from today, let it be the critical importance of adaptive functioning.
It's the key metric. It's the key. Measuring those practical skills, communication, socialization, daily living, it's the best tool we have for predicting long-term outcomes and for figuring out way to focus your energy first.
So the goal is always tailored intervention, focusing on the core ASD-related deficits, supported by managing the ADHD symptoms.
Precisely.
And that really leads us to a final thought for you to take away. We've established that the severity of the ASD symptoms is the strongest predictor of those long-term adaptive skill gaps.
Right.
So how could we fundamentally change the future for these kids if we made comprehensive early intervention for communication and social skills the absolute non-negotiable first priority? If you're on this journey, I'd really encourage you to consider pursuing a full adaptive behavior assessment, getting that blueprint, knowing exactly where the skills are lagging behind IQ. That's the most powerful first step you can take.
Thanks for listening to Angel's Awesome Minds podcast. Don't forget to visit Angel's Awesome Books at angels-awesomebooks.com for more tips and resources.